Absolutely. Good afternoon, everyone, and welcome to the Technological Leadership Institute and to our webinar today on leadership and innovation in a crisis, lessons learned during the COVID-19 pandemic. My name is Dan Moradian. I'm the James J. Rainier Chair in Technology Management, Director of the Graduate Studies for TLI's Master of Science in Medical Device Innovation. I've got the pleasure of moderating today's panel. I'm joined by my colleague, Ali Kumalin, who's our Program Admissions Associate, as well as our esteemed panelist. Oops. By way of introduction, we find ourselves today in the middle of a global healthcare crisis, but it's also a global economic crisis and a global humanitarian crisis. We think back to January and February of this year. How many of us would have imagined in just a few short months how quickly our lives would change? I think we all understand that it's not the first, nor is it likely the last crisis that we'll have to face. But of course, with crisis comes opportunity, as Albert Einstein famously said. And the central question for today's discussion then is, how do leadership skills and an understanding of innovation process help medtech innovators seize the opportunities that exist in difficult times? We're joined by three panelists today. First is Shannon Williamson. Shannon is a user experience designer at Medtronic Corporation. She's also an alum of the TLI's MS in Medical Device Innovation program and a member of the class of 2017. Prior to joining the program, Shannon was a successful apparel designer who wanted to use her design skills to improve healthcare outcomes. She joins us today to share her unique experience in leadership and innovation during the ongoing COVID pandemic. Our second panelist is Dr. Joe Hale. He's a mechanical engineer by training with degrees from Boston University, Clemson University, and the University of Iowa. He's a member of the TLI faculty and has been since the MDI program's launch in 2014. He's the former director of the Innovation Fellows Program in the Bakken Medical Device Center, a member of the inaugural class of fellows in that program as well. He's currently a consultant and advisor to a number of startups and early stage companies in Minnesota and elsewhere. He's instructor of our program's Biodesign Practicum. Joe shares his extensive experience in the principles of biodesign, including need finding, ideation with our students. He's here today to share his perspective on innovation with all of you. And finally, Steve Webster. Steve is our Edson Spencer Chair in Technology Management at TLI. He's a member of the MDI faculty as well as the MOT faculty, and he too has taught in the program since its launch in 2014. He's an electrical engineer by training with both MS and BS degrees from MIT. He's got a long and successful career, first at Bell Labs and then for over 30 years at 3M, including 12 years as a VP of Research and Development, commercialization there. He brings his extensive experience in innovation and innovation culture to TLI and to the MDI program. He joins the panel to share his perspective on leadership and innovation in a crisis. We've invited each of our panelists to give a brief presentation, and then the panel will take questions from the audience. Before we begin, just want to remind folks that if you want to ask a question, you can use the Q&A feature at the bottom of your Zoom screen, and the moderator, Ali, will be moderating the Q&A section and then read back the questions. So with that, let's get underway. And it's my pleasure to introduce Shannon Williamson for her presentation. Welcome, Shannon.
Hi, thank you, Dr. Moradian, for that introduction. I am very excited to be here because this topic is so relevant and something that I am extremely passionate about. So I'm going to share a brief case study that's affected me during this pandemic. But before I do that, I wanted to just expand on my background a little bit. As Dr. Moradian mentioned, I have a bachelor's degree in apparel design from the University of Minnesota. And now I'm in medical devices. So I took quite a pivot in my career, and had, after I was working in apparel design, I had this desire to make a difference in health and people's lives, and initially thought maybe medical school, knew I had to do something, and I found the Medical Device Innovation Program, and it was just the perfect fit for me. It made me realize that I could still use my creative design side that I absolutely loved, but I could make that difference in people's health and lives. So I'm so fortunate to have found the program that really accelerated me to the fellowship at the Medical Devices Center, and then eventually I wound up at Medtronic as a user experience designer. So next I will share a little bit about what I'm going to discuss today, and that is the design process. Some of you might be familiar with this, but it really starts with that question: what are we trying to solve? And then from there you go into this iterative process of research, design, build, test. Generally you keep going, you do improve, and then you get into research and design, and you do that a while until you have a successful test where you can launch the product. During a pandemic, as you can expect, things are a little bit different. So we will go over that here. First, for me, in this kind of case study example, is the question, what can we being the general public, what can we make with materials that we have on hand in our homes to help stop the spread of COVID? And then secondarily, how can we, being myself or professionals or whoever is releasing this idea, how can we disseminate this to a large audience with a varying level of skill sets? And so this question really came about as a result from just some conversations with physicians in the community. There was clearly a need that we needed to solve, and that question came about. So to start that, we had to go into research here, and we had ideas of how this might work, different materials and designs. If you look at the materials you have at home, conveniently, Cambridge University had released this study, and you can see there that looking at these household materials, the pillowcase and the cotton t-shirt were found to be the most suitable materials for an improvised face mask or face covering. So that's very exciting, that kind of this initial idea of perhaps a cotton face covering was reinforced by this research material. And then Dr. Rainey, if you want to advance, we have a couple pictures here on the left. The first being this N95 mask, and that is something that was in shortage. It's in great demand, and it's because of its successful design, both with the materials that it uses, but also its very tight fit around the face, which helps protect everyone. So what could we maybe do to mimic this design or to mimic those materials? Below that is a pleated face mask, which is relatively simple. This is the one that Allina had used, Allina Health, in their mask drives. And then advance one more. Here is another mask design. And this is as you can see, a more contoured design. So really looking at what's out on the market in order to best influence the design, which is our next step. And then as you think about that design, it's important to consult with your subject matter experts. So in my case, I talked to anyone who would listen. I reached out to old colleagues. I talked to people at the university in material science and apparel design. I talked to material scientists at my current company, physicians, designers, seamstresses, anyone whose opinion I could get to develop the best design. So when looking at the design, for this step, I have kind of the design and build side by side, because it is really that iterative process where you repeat. So I had started on the left there with one of the masks that was pictured on the previous slide. And you can see in that image below that there's a big gap at the top of the nose bridge. And so I knew we had to change something there. Looked at adding some nose pleats, adding some wire, changed the length, tested that again, added some side pleats, realized that that was really bulky, that probably wouldn't work. And in a normal process, you would test this on a variety of people. But because of the pandemic, all of this happened in a week in March, or a weekend. And I just didn't have access to those people. So thankfully, my husband was a very good sport. I could try it on his face shape, see how this, how we could make one size that really fits both men and women of different sizes, made some more changes, and then had this final design that I was ready to test. So part of that secondary question that we asked, how can we disseminate this information to a large group of people of varying skill levels? So it's important that we could have a document, 1 or 2 pages that people could print, that was really a step-by-step guide. There's a lot of YouTube videos out there, there's a lot of blogs, but because of the way that this was going to be disseminated, we had to keep it short, we had to keep it concise on these 2 8.5 by 11 pieces of paper. So we have the pattern there, we have materials, and then we have this step-by-step directions that are photographed there. And to test this, I reached out to 2 quilters that I know that were willing to help, and they're very experienced in quilting, but they haven't worked in the 3-dimensional shape. So this was a unique challenge for them. I got some feedback, I made some changes, and from there I was ready to launch this. So when it came time to launch, the first place that I released this information was on social media, one being LinkedIn. And then from there, the university, they published an article about it. A website called Mass Facts had featured it had shown it as a featured design on their website. And then the Star Tribune also published an article with a lot of people who are working on mask designs, and then had featured this design as well. So this is my most recent example of how I followed the design process and how I was able to innovate in crisis. Maybe not, using my current skill set or my current job at my company, but using my background and using everything that I've developed to this day, and do something that could help people. And so, like I said, this design process is something that I try to follow in my day-to-day whenever I'm designing, and it really, really helps you have a great product in the end.
Thank you, Shannon. Up next is Dr. Hale.
Thank you. And thank you, Shannon. That's a great lead into some of the things that I want to talk about. As Dan said, I did my graduate work and my Ph.D. at the University of Iowa, but have kind of bounced around since then between academia and industry, doing research type things, doing some commercial product development, and then most recently was the director of the Innovation Fellows program at the university, and continue to teach the practicum within the TLI program. I wish I could say that path was intentional, was all planned out, but that certainly was not the case. But I think it has brought together a number of interesting elements that I could have never anticipated or planned in a way that's very conducive to the innovation process. You want to go to the next slide? So Shannon did a nice job of kind of laying out that innovation process. It's very iterative. It's a lot of work. And it's not just the light bulb coming on that some people envision. Whenever you see a cartoon and somebody has a great idea, it's always that light bulb coming on. That's kind of the end of the process. There's a lot more to it up front. And that's what we focus on a lot in the practicum, is learning that process and starting out with what that initial question is. Next slide. And that's what we call needs finding, trying to identify what the problem really is. Doing a lot of clinical immersion for clinical type problems, trying to understand who the customer is, what their needs are, how the existing products perhaps fail to meet those needs in an optimal type way. Next slide. So this is an interesting quote from Abraham Maslow. He said, I suppose it's tempting if the only tool you have is a hammer to treat everything as if it were a nail. And that's kind of the downside to not doing the needs finding. If we start out with a solution, start out with a product, instead of understanding the need, then every problem we come up to, we're treating it as a nail. We're trying to figure out how we can take that product, that solution, and mold it to match the needs of the customer. And it may not be at all what the customer needs or wants. Next slide. So as we went into this pandemic, there were a number of needs, number of opportunities that came up. And a lot of them had to do with critical shortage of PPE, critical shortage of ventilators. And this article was published back in March, but just yesterday on the news with all the resurgence that's happening in different parts of the country, we're starting to hear those same kind of needs resurfacing again, where there's just not enough ventilators, not enough PPE, not enough gowns, masks, whatever it might be. So it's an ongoing need, and one that lends itself well to the innovation process. So Shannon talked about one of those needs, and that was the mask. And when we talk about these needs in the practicum and as part of the biodesign process, we create what we call a needs statement, and that has the form of that sentence that's at the top of this slide. A way for someone, for the customer, whoever our customer might be, to do something in particular to accomplish some end result in order to, and that's the why. So it's the who, what, and the why. It's never the how. We don't want to embed a solution into this. We just want to understand what the need is, who needs it, what they need, and why they need it. So in this case, depending on how we define the who, we could come up with a very, very different solution. So if we're talking about healthcare providers that are in a healthcare environment that have access to N95 masks, that know the proper fitting procedure to wear those masks and be fitted for them, that might be one solution. If we're talking about something, if the customer is the end users, the general public, that doesn't need this for an 8, 10, 12-hour shift, they just need something to go to the grocery store, that changes what that need is a little bit. So in that case, the do-it-yourself approach, creating these masks, was certainly a viable solution. But it gives you an example of how, when we write that needs statement, how do we define who the is or what or the why, it potentially leads us to a different solution. Next slide. So similar kind of thing with the respirators. The hospitals were saying they didn't have enough respirators. The picture on the left-hand side is one of Medtronic's devices. Actually, I'm not sure if that's theirs, but they make a comparable product that costs somewhere between $32,000 and $48,000 for each one of these pieces of equipment. They're very complicated. They connect to a number of sources within the hospital, and they provide a lot of metrics in terms of how the patient is responding to treatment. On the right-hand side is a low-cost ventilator that was created by the University of Minnesota, the Bakken Medical Devices Center, and some of the clinicians from the academic health center. And again, it's kind of a difference in how we frame that needs statement. In this case, maybe it's more the what. Do we really need all of that instrumentation that goes along with the ventilator on the left that we're paying tens of thousands of dollars for? Or do we just is the need actually just something that automatically compresses that bag valve to provide respirations to the patient? So I think this was another good example of how understanding that need and how we formulate that need statement maybe leads us to a very different solution. And if we take that one step farther, last slide, maybe we don't need to ventilate the patient at all in the way that ventilators typically work. Typically, those patients are intubated, and that comes with a whole host of other complications and consequences for the patient longer term. So there's actually a company in Texas who, prior to the pandemic, was manufacturing these helmet type devices that provide high flow oxygen to the patients. And their business has seen an incredible uptick as a result of the pandemic. But these devices dispense with the need to intubate the patient. So it actually still provides, except in the most severe cases, provides what the patient needs. It understands that the need is not necessarily to intubate them and to provide respirations in that manner, but to assist their respirations by providing high concentrations of oxygen. So a little bit more extreme example, but again, it goes back to understanding what the need is, who the customer is, and why they need that. Next slide. And Dan started out with one of his slides with a quote from Einstein. So I think maybe it's appropriate to come back around to this. We certainly weren't, or Einstein wasn't thinking about design thinking or biodesign in his time, but he had a very similar approach. And he said if he had an hour to solve a problem, he'd spend 55 minutes thinking about the problem and 5 minutes thinking of the solution. And that's kind of the approach that we're taking with the practicum and with the biodesign process, is to really understand what the need is, who needs it, and why, how we measure success, what the metrics are that are involved in doing that. So I think there's lots of opportunities, as Einstein's other quote said, to apply that process and to be innovative in how we think about the problem and how we create solutions to it.
Thank you, Joe. Our third panelist is Steve Webster. Steve, I'll turn it over to you.
Thank you, Dan. I think the theme about crisis also being an opportunity is a terrific one for this discussion, and actually what I'm going to talk about, because while that is absolutely true, and you do things during a crisis that are different than you might do them otherwise, those fundamentals still apply. And if I could see the next slide, one of the things that you saw both in Shannon's example and in the previous talk was discussion of design-driven innovation. I have to admit that when I first heard the word design-driven innovation, I thought, well, that's how you make things that look cool. But that really, nothing could be further from the truth. Design-driven innovation is really a way of understanding that design is, in essence, making sense of things. It's not just looking cool. It comes from a rich idea space. As you saw some of that stuff that Shannon talked about, you saw examples of a designer, technology was involved in that, but everything that you do, everything that forms your idea space that causes that light bulb to go off becomes part of the way you think about a design-driven innovation. All of that surrounding the user and all of that surrounding a way to make their life better. Terrific example that Shannon gave. Dan, if I could have the next slide. Remember, as you're doing that, all the fundamentals still apply. You've all heard of the 3 R's, right? Reading, writing, and arithmetic. Well, I've actually come to now talk about the 3 R's of relevance, regulation, and reimbursement. Because at the end of the day, you do actually want to make a business out of this. You want to make something that will sustain and actually meet your final objectives. Requires, of course, that your idea be relevant. Relevant to a doctor, relevant to a hospital, relevant to the whole care system. It has to have a relevance for somebody who's actually going to use that product. Shannon, of course, was talking about something that was relevant for people who aren't normally part of the healthcare system. And I think that's a great one to think about as well. What makes healthcare so unique is the regulation and the regulatory pieces. Even recently, people are still asking about, make sure that thing works before you put it in my body. Make sure that thing actually works. There's a set of regulations. Sometimes they may seem bureaucratic, but they're really put there designed to make sure that products do work and that they are effective, and they are effective inside a human being for a long time. And thinking about that at the beginning is one of the most important things you can do in a successful innovation. And of course, the last piece that is unique to healthcare is that the person who benefits from the product may not be the person who actually pays for it. Maybe the government, maybe a private insurer. And remember, you've done all this work, you've made a difference in somebody's life. You've earned the right to make a buck in return, right? So if you're going to have a business, somebody's got to do that reimbursement. And the earlier you think that through, the better off you're going to be. And of course, your starting point in an innovation doesn't have answers to all of these, and certainly not airtight answers. But the process makes more sense if you think all of these in mind at the dance at the beginning, where you focus in on what best meets the needs of the customer, how you can get that regulatory approval, proving that it's safe and effective, and ultimately that you will get reimbursement for it. Dan, as you work, I'll ask the next slide. As you work, by the way, sumo is one of my favorite sports. That's why we've got this slide. As you work through this process, you might start thinking of yourself as a superhero, right? I'm going to knock out every obstacle in the way. I'm going to get all those managers who don't understand, and I'm just going to knock them aside, right? Well, that doesn't usually work. It's not the world we live in. In reality, leaders are not trying to be the victor of a sumo match, but if you turn to the next click, Dan, you'll see that leaders are trying to build much more of a jazz ensemble. Leaders need to work with a variety of people who have a wide range of roles and a wide range of perspectives, and all of these count if you're going to make an innovation happen. That means you need to understand their perspective and negotiate a common path going forward. So an effective negotiation is not a sumo match. It's not like this. Instead, it more resembles a jazz performance as you find a way to align the interests and let everybody in that table have a win, while of course achieving your goal. One of my favorite quotations is that negotiation is the art of letting the other person have it your way. And we spend a little time in MDI 5010 on that. The last slide I'd like to talk about is that with all of this in mind, and you're trying to do something, particularly in a crisis, maybe there's a temptation to make a shortcut or do something that's easy. Well, a leader who's not ethical may find the occasional short-term win, but they will not be a leader of others for very long. In MDI 5010, we actually talk about this theory and practice of ethics. It's especially important for anyone leading the development of a healthcare device. And we talk about that in terms of the theory and all the principles that are out there. But we also use one of the worst examples of recent years that comes out of a company called Theranos. Came out of the Silicon Valley, fake it till you make it kind of an ethos. And quite frankly, if you're developing an app, maybe you can do that. Maybe you can get away with it. But if you're developing a medical device, something that's going to tell people whether they're really sick or something that's really going to help a person stay well, you've got to get that right. And the bar is a whole lot higher when you're living in that world. And the fake it till you make it just doesn't really apply in that world. And we spent some time in class on that as well. So with all that in mind, I guess I will hand it back to Dan and just summarize by saying that even when you're in a crisis and you've got a lot of things going on, remember the fundamentals still apply. You have to still have the basic fundamentals of building a business, the 3 R's. You have to negotiate and work with other people, and you have to do it all in an ethical manner. Thank you. Dan?
Thanks, Steve, and Shannon and Joe, thank you as well. Great presentations, unique perspectives, I think fold together quite nicely. So Allie, do we have, just a reminder to our audience, if you've not already asked a question, if you want to ask a question, please use the Q&A section at the bottom of your screen. We're going to turn now to a question for the panelists. So Allie, do we have any questions?
Yes, like Dan mentioned, please feel free to send a question that you have through the Q&A feature. I do have a couple questions that we can start with here. So maybe this one for Steve, as someone who worked for many, many years at 3M in a culture that's really innovative, could you tell us maybe a little bit, or could you comment on the importance of culture in a business decision making? Especially in a crisis with an emphasis on innovation. Are there examples of your time working at 3M and how you responded to like a crisis and maybe something similar to COVID, but something like that, if you could share?
Believe me, we had a number of crises in my time, but nothing like COVID. I mean, nothing like that. Actually, it's interesting because 3M is the world's largest maker of N95 masks. So the amount of innovation in supply chain and manufacturing thinking that has gone on over the last few months is interesting. I happen to think that innovation, really culture is everything. Obviously there are processes that help, and there are procedures, and there are all these things that help drive that culture into place. But it is it's really about a sense that people get up every morning, look in the mirror, and are discontent with the way things are. And say, what am I going to do today to make things better for a customer, to make things better for my factory, to make things better for somebody? And if you have that level of discontent, you're halfway to having the right culture, I think. Certainly that you have to continue to drive that right culture. And if you're a leader in that culture, particularly in a tough situation such as we're in now, being able to stand up and say, here is a perspective on what the future will be like. People hate complete uncertainty. They hate the I just don't know, even though we in fact don't know. But if you start saying, here's what I do know, and make it credible, not just pie in the sky stuff, but a credible vision of how we're going to get through this thing and where we're going to get to the other side of it and what the world's going to be like, that also helps create that culture where people can feel a little bit comfortable. And that little bit of comfort becomes important as part of the innovation process, because people have to know that their ideas will be supported no matter how crazy their ideas are. You should have an organization that starts with yes. Always starts with the thought that let's say yes to that idea, and maybe it could combine with other things and become really great. And there's always time to say no later if it doesn't work out. But if you start from yes, you're really going to have something. So it's all about culture. Culture is the whole thing, and leaders have to drive people who want to do better for the world, and leaders who help those people relax and be appreciated and realize that they every day can go about and do that.
Great, thank you. We have another question. I think this one's geared more towards Joe. So Joe, if you could speak a little bit about your career that spans several decades, both in academia and industry. One of the quotes that you used was the quote about the hammer. And if you're taking every problem as if it's a nail and using the hammer, can you talk a little bit more about the importance of developing your innovator's toolbox and provide guidance on how people can make or look for new tools, and kind of what you guys do a little bit in the practicum to help, develop that?
Yeah, I think there's a couple elements to that. One is that a tool is just that, it's a tool. It's to help you accomplish some end. So there's an anecdote I've heard a couple of times about the engineer who goes in to solve a complex problem at some place, and they've been working on this piece of equipment for a long time, and he walks in and picks up a hammer and hits it, and everything is fixed, and he charges them $50,000 for it. And they're like, $50,000? I could have done that. He said, yeah, it wasn't for hitting it with the hammer, it was for knowing where to hit it. So I think that's the key with some of these tools, is you have to know how to use them and how to use them appropriately. The other part of that is I think there is kind of this intangible element that just comes from diversity of experiences and backgrounds, and we try to build that into the practicum as much as we can. And I guess I would encourage people to take advantage of those kind of opportunities, to not shortchange yourself in terms of your backgrounds and experience, because I think that's what makes the innovation process really fun and really exciting, is when you can bring together an engineer and a fashion designer and a business person and combine their different perspectives in terms of the problem that's being addressed. If you have 5 engineers working on a problem and they all have the same background and same training, of course they're going to come up with the same. It really narrows their perspective in terms of what that need is and ways to go about addressing it. So to the extent that our audience has the opportunity to dabble in other areas, or maybe bring in some of their experiences from their hobbies or avocations, I think those things are all relevant and all kind of play into the innovation process in ways that we just don't fully understand and can't quantify until we're in those situations.
Great, thank you, Joe. So we have a question that came through, 2 parts. So the first being, how does this process apply to new technologies that don't yet have a proven market audience? And how does one, quote, need find when they're also searching for applications of new technologies? I can repeat that if you need me to.
We'd like to take a shot at that one.
That's a good one.
I can reread the first, if you want me to reread the first part.
I'm looking at it in writing here on the screen. I can see it.
Okay.
I'll take a slot at the first half, because we actually talk about this a little bit in 5010. Sometimes a new technology is created, and yet it's several steps away from when it's actually going to be something that really makes a difference in someone's life. And in those cases, you really have to do some thinking through at the very beginning of what is the technology, both in its, what is it in its totality? What are all the options? What are all the paths you could consider for that technology? Because sometimes you can find, you can find a sort of a lily pad, if you will, which actually allows you to get an early application of maybe a simplified version of the technology to keep the program alive, to keep the funding coming. So you can actually get something that's fairly simple started, and then you have a little bit of money to work on something that's more complicated. I will say that some of the design-oriented type of procedures don't work quite as well in this case. But at the end of the day, if you're not meeting a customer need, if you're not doing something that they need done, they're not going to be interested in it, even if you're doing it in a totally different way. Steve Jobs was great at that. He used to say, the quotation from him is, people don't know what they want until I show it to them. And there's a little bit of an element, I mean, there's some reality to that if you have a genuinely new technology. But I think there are some tools that can help you think through a technology to look where it might be interesting and where you can actually get that first lily pad that allows you to actually realize the potential for the technology. Joe, I saw you nodding your head a little bit. I thought you'd like to weigh in on that.
Yeah, I mean, the Steve Jobs quote kind of came to mind too when I was first reading the question. As far as the second part of the question, I mean, how do you go about needs finding when you are searching for applications of a new technology? I mean, you can, and certainly this applies to companies that are trying to develop new products, and they're not going to go out and in most cases have the time or the expertise to develop a whole new technology. They're looking for ways to market their technologies and expand them into new markets. So you can kind of approach it from the reverse direction. But I think the key to doing that is still the validation that a need exists, to find out who your customers are and talk to them and figure out what it is that they really need, and not just assume because you have a technology that's going to be the answer that they want. And I mean, engineers are notorious for doing that. I mean, we're natural problem solvers, so we come up with these solutions and we think everybody should just adopt it because it's cool and we're infatuated with the technology. But it unfortunately, from a business perspective, doesn't always work that way. So I think if you're going to approach it from that direction, you still have to be willing to accept no as an answer, and understand who your customer is and whether that's something that they are really going to adopt or not.
Shannon, do you have anything to add on that question?
Yeah, I mean, I do think that there are always ways to needs find, and Dr. Hale did mention it a little bit, but just through a lot of observation and talking with as many people as you can. One of the things that was really valuable to me when I was in the program and in the fellowship was we did an ambulance ride along. And that's just a great example of you talk to EMTs, they maybe say what they need or they need something smaller, but until you're actually sitting in that space and you're seeing what they're seeing and what they're using and what they're not using, you approach it a little bit differently. And so even if it is a new technology or a new application, try to observe however you can. Observe in a hospital if you can, or observe in a home, because people oftentimes say that they need things or want things, and that's not always the solution.
Thank you. Ellie, was there a second part to that question?
Nope, it was just the two parts.
Okay.
We have another question that came in, and it says, "Hi Dan, it's Jen from Croesus." Quote, "The summer 2020 Harvard Business Review headline article discusses, quote, leadership in a permanent crisis. The premise is that although the economy will recover, new modes of leadership will be required. I'm interested what leadership key takeaways or skills the speakers have realized over the past few months."
Great question, Jen. Panelists.
I can take a first shot at that. One of the things that I kind kind of one of my takeaways, I guess. And I don't know that this is really a new thing, but it's become more central, I guess, because of the pandemic. And that is for leaders to be proactive and to look beyond the current situation. Rather than looking at what the needs are that face us today, thinking about where we're going to be 3 months, 6 months, years from now, and trying to identify those needs and those opportunities and react to them proactively rather than waiting until we have these shortages, until we have a problem that we're forced to respond to. And you can kind of think about how that, if we had those kind of leadership things in place 6 months ago, a year ago, how things might be different today. I think that's kind of the reason we need to be thinking about 6 months, a year down the road, not what's happening today or next week, but how is this going to impact our lives, and how can we, as innovators, as entrepreneurs, as business people, react to those in ways that are going to make a difference.
Joe, I couldn't agree more with that. I think one of the things I kind of mentioned earlier, but is the importance of leadership providing a rudder, a sense of direction, a sense that we are going someplace, and there's a lot of things we don't know about the future. There's a lot of things we're going to experiment on and we're going to find out. But here are some of the possibilities of where the future can be, and have a really engage the entire organization in doing that. I think the more you can get especially in a time like this, expertise doesn't quite count for as much as it used to, because a lot of hard-earned expertise does in fact not apply to this situation. So the more you can engage everybody in being part of looking at what that future's like, looking at some of those scenarios and how we can make a robust response to that, and the leaders saying, regardless of the details of this business, here is some of the things that we are going to depend on, we are going to build going forward. And that just becomes more important than ever. It's kind of called the utility of leadership. There's a reason you have leaders. This is what you pay them for, and they really have to step up and do the job and provide that kind of a rudder to help people get through this.
Yeah, I would like to add to that from a different perspective. I am very new in my career. I've made this career pivot. I have been at Medtronic for 8 months. And so when this crisis happened, I'm not in a position of leadership. And at my company, I wasn't sure that there was anything I could really do, just given my inexperience. But that doesn't mean that you can't be a leader and that there's not places for you to be a leader. And that's really where your background comes in, your prior experience, your network, because no matter what your position is, there's always opportunities to step up and to find those places of leadership.
Shannon, again, I've got to agree with that, because leadership is not about your job title. Leadership is about the way you do your job day in and day out. And everyone needs to come into the office and show some form of leadership, regardless of what their job title is.
It strikes me that this really does close the circle. This question closes the circle to some extent, because it is, as I listen to the three of you, it is about culture, it's about process, it's about preparation, so that in that moment of need, the framework is there for you to lead effectively and to make decisions effectively. But of course, that's part of what we try to do in the program, and what you all do in your careers. Allie, any other questions?
Just one last question. Maybe, Shannon, you talked a little bit about this in your answer just now, but maybe you could elaborate a little bit more. As somebody who made what some might consider a dramatic career shift, pivoting from your undergrad degree in apparel design to working in medical device, can you talk a little bit about that experience, and maybe some things that you'd want other people to know based on your experience, and kind of like what your transferable skills and things like that, because we get lots of questions on that kind of career pivot and what it was like for you.
Yeah, of course. So yeah, as I just alluded to, one of the biggest things is your background is relevant, no matter what it is. You're not starting over, you're building on what you already have. And fashion design and medical devices can sound like two drastically different worlds, but it's been really surprising to see how much they overlap. And even on my current team at Medtronic, there are two other human factors engineers who have apparel backgrounds. So this is something that companies really value. They value people with these unique experiences and these different approaches. So that would be one thing I would keep in mind is everything is relevant. And then secondly, it's really important to be persistent and resilient. Even though you are making this career change, it's not easy. You're not starting over, but there's a lot of work ahead of you. And sometimes it can feel like you're taking 2 steps back to take 1 step forward. But it is all worth it, and you will get there. And there's an incredible network of people that are so happy to assist you in the program, in the MDI program, in the medical device industry in the Twin Cities. So keep pushing, keep going, and you will get there.
Great, thank you for sharing.
All right, Allie, if there are no other questions, we might ask whether the panelists just have any closing thoughts.
Well, I can't be given a chance to have a microphone and not say anything.
Sure.
So I mean, I would think, for me, the pandemic does show that those fundamental principles still apply. You can't panic. Yeah, there's a lot of things going on. There's a lot of changes. Yeah, avoid panicking. Panic never helps anybody. And then the importance of these leadership characteristics, whether you have a big fancy job title or whether you're just doing a job somewhere in an organization from your bedroom, you can still bring leadership to the party every day. And that's how you build the culture that 5 years from now and 10 years from now is still going to be sustained and growing and be a really successful enterprise.
Excellent. Thank you, Steve. Joe, Shannon, any closing remarks?
I'll just make one comment. I think it was Steve that said something about, we crave certainty, and that's just the way we're programmed, the way our minds work is to always want to know the answer and where we're headed. And one of the things that I have always told the students in our program and the fellows as well is that they need to get comfortable with being uncomfortable, because we just don't know. And as uncomfortable as that is, I think that's the exciting part of these opportunities and innovation is just discovering new things and new ways to apply things and new solutions to problems. So I think there's a lot of opportunities here. We just need to learn to think about them in new ways that may not be comfortable, but ways that ultimately I think will lead us to better solutions and a good outcome.
Excellent. How about you, Shannon? Any final thoughts?
Yes. As challenging as this pandemic has been, it's been wonderful to see all the innovation come out of it and all the relationships between people and parties that wouldn't have worked together before. So It's been fun to see that come together and to be able to use knowledge that I've learned from the program and realize that there's a lot out there to do still with, just with COVID, but with everything. And so innovation is a very long and exciting road and fun to be a part of. Excellent.
Thank you, Shannon. I think one of my observations over the last several months has certainly been that some of our alums, our faculty, our current students, in a crisis like this, there is this drive to do something, to apply what they know and to be helpful. And whatever, as Steve and others have said, whatever level of the organization, whether it's personally or professionally in their work, there is a desire to translate it into some good for some common good. And the starting premise for me is that certainly we need to know how to lead, but that we also know we need to know what to lead. because not all paths are the best path. And while we don't know necessarily what the best path is, armed with process and understanding, a positive culture that accepts risk, you're less likely to follow false paths, and that in itself is helpful. So I really appreciate all of you taking the time to be with us today. Certainly, Allie, thank you. Thanks to all of the audience members online. I think we've got one final slide. Can't get away without at least a slide about the program, of course. So we are here as faculty and alums from the MS in Medical Device Innovation, and it's now in its 6th year. It's a program that really has been designed to meet the needs of early career professionals, folks like Shannon and others. Helps you develop your skills in leadership, medical product innovation, and biodesign. We're proud of our cohort model. We limit enrollment to 30 students. One class goes through the program each cycle. Our courses are scheduled for the convenience of our students, meeting in the evenings on Monday and Wednesday, and then on Saturdays for our practicum. Electives, of course, are excluded from that because we don't control when they're offered. Courses will begin for the next cohort in the fall of 2020, and there's still time. If you or someone you know would be a good candidate, we'd certainly like to hear from them. And an important addition this year is that when we start the program in the fall, we'll have both a traditional option, which is in some respects accelerated at 16 months over 4 semesters, but we're introducing an extended option as well that allows our students to take a little more time to complete their capstone, which is an important part of the program. We do that over an additional semester. So our next info session is on Wednesday, July 22nd. It's a lunchtime session, and again, if you or someone you know would be a candidate, if you're interested, please reach out to Allie and join us for that info session. And with that, I just want to thank everybody again for attending, and look for our next webinar. We're gonna hopefully plan more of these in the future. So thanks, panelists. Thanks, Allie. And thanks to the audience.
Looks like we did have one question that just came through from Jen.
Oh, great.
About the program. It's just about the program. Yeah. So
okay.
Clarification question, is the program on campus or also via video conference? Teleconference, sorry.
Excellent. It's a great question. So, presently the courses are being held exclusively online through the pandemic. The university has not made a final decision about plans for the fall. It looks as though they're tending towards having at least some on-campus courses. But there will be options. There will be options for remote participation as well, and I think that is likely to be TLI and the program's perspective. We may have some online or some in-person classes, but I think for putting safety first, we'll continue to have remote access. So remote synchronous access largely for folks who would prefer not to be on campus. And we'll know more in the coming, I would say the next month or so, we'll be able to provide more information. Allie is a good resource for that as well. All right.
That's all we have for questions.
Thanks, everyone. Really appreciate it. Again, thanks, panelists.